Alright guys, good day. I hope you can all see and hear me. Can you just drop a comment down below if you can see and hear me well? And then we can get started for today's lecture. Alright, seems like you guys cannot hear me. Can you hear me now? Can't hear me? Alright, hold on a second. What about now? Can you guys hear me now? I'm sorry, there seems to be some troubles with the audio. So let me fix that and then we can get started. Alright, cool. Perfect. So you can hear me? Great. Alright, so today's lecture is going to be about the neurovasculature of the leg. So it means nerves, arteries, veins, and also lymph vessels. I'll try to do it in under 2 hours, so I'm aiming at 60 minutes, 90 minutes, but we'll see how far we can get. It's quite a vast topic. And I will also be turning off my camera just for the reason because my webcam is that direction and my working monitor is that direction, and I don't think it's relevant nor beneficial to you in any way if you see me speaking from the side. But I will be turning it on if we have some discussions at the end maybe, or if you have some questions. Yeah, if you do have some questions, just drop them in the comments and then we'll go over them either, I don't know, whenever they come in and I see them, or at the end, or in between when we make a little break. And so yeah, let's get going. Yes. Alright, so neurovasculature of the leg. Yeah, so arteries, veins, lymph nodes, we had that. And if we do have time in the end, we can do a little quiz. But let's get started with the arteries. So generally arteries, you already know, are vessels that will transport the blood from the heart, from the heart to the periphery. And that includes, of course, the lower leg. Now, these are the main arteries that we're going to just discuss today. And of course, their courses and branches as well. So the first one will be the external iliac artery. Arteria iliaca externa is actually not a vessel of the leg, but it is important because it's, let's say, the connecting route from the aorta to the leg. Yeah, so if I zoom here into this model, I hope it works smoothly and you can also see it. No, of course it's not smooth and leggy. Alright, so marked now is the abdominal aorta, which will split into its branches of the common iliac arteries. So arteria iliaca communis, and then we have the internal iliac artery and the external iliac artery. Don't worry about the internal iliac artery, you'll do that when you discuss the arteries and vessels of the pelvis. For now, it's arteria iliaca externa, and it runs medially from the border of musculus psoas major. Now, it has two branches, which leave the vessel approximately at the same height. So once again, I'll try to zoom in here. And you can see the first one, this one, it will leave laterally. And this is arteria circumflexa ilium profunda. So it means it's the deep the deep circumflex iliac artery, and it will run towards this bony structure over here on the very far left, and this is spina iliaca anterior superior, yeah, or in the English abbreviation is also ASIS, which means anterior superior iliac spine, and it will follow its course. It's not this one, I'm sorry. It is. No, I can't seem to hit it. All right, I'll just show you with the mouse. So this one here, yeah, and then it's later and more laterally it will follow the course of crista iliaca, as you can see here. Yeah, so it's this one here. All right. Now, the second artery is arteria epigastrica inferior, the inferior epigastric artery, which leaves at approximately the same height. So it will be this one here. However, it will ascend directly in ligamentum interfoveolare. Yeah, so you will also learn about that later. For now, it's just important that you know that it will form an anastomosis with arteria epigastrica superior, which is a terminal branch of the internal thoracic artery, which should already be familiar with you, because it's one of the branches of the subclavian artery. Another important thing about the inferior epigastric artery is corona mortis. Corona mortis is a special name for an anastomosis formed between two branches, which is between the pubic branch of this inferior epigastric artery. This is really hard to get the arteries right, I'm sorry. So it is an anastomosis between the pubic branch of the inferior epigastric artery and the pubic branch of the obturator artery. Yeah, so you can see, let me try something else if this is not working. I hope you can see that. So we have here inferior epigastric artery going like this, internal obturator artery, probably this one. Oh, that was stupid. And here the pubic branch will go over ramus superior ossis pubis and will anastomize with the pubic branch of the internal obturator artery, if that makes sense to you. And it's also frequently asked in the dissection exam, so be sure to remember it well. The reason for this name is because back in the days during childbirth, this was commonly injured, and because it's not like a large lumen vessel, you wouldn't like bleed to death immediately, but with time, slowly, you will lose a lot of blood, and you will die. Alright, so what's the fate of the external iliac artery? It will become the femoral artery after passing under the inguinal ligament and entering the lymph, and it exits through lacuna vasorum. And I don't know if you've already studied it with the muscles, I guess so. Lacuna vasorum musculorum, we will also see a picture later. Now, arteria femoralis. So the femoral artery is the main supplying vessel for the leg, and therefore it's also really important. Yeah, it's also clinically important because it serves as an entrance point if you want to access the arterial system, for example, during catheterization for the heart. The femoral artery, again, is the continuation of the external iliac artery, and it will run laterally to the vein. Yeah, so this is also an important relationship. And the first branch that it will give off is the superficial epigastric artery. Yeah, so it is this one, arteria epigastrica superficialis, which will ascend in the subcutaneous tissue of the anterior abdominal wall and supply it. Now, another branch is arteria circumflexa ilium superficialis. So you remember from the previous slide we had arteria circumflexa ilium profunda. So this is the superficial analog of it, and just like the deep one, it will run towards the spina iliaca anterior superior, and will form various anastomoses. Yeah, so you can see here it serves for the supply of the lateral and anterior part of the thigh. All right, next one. Sorry, it's still a femoral artery, just different branches. So really important branches is this one, arteria profunda femoris, and this is kind of similar to arteria profunda brachii. Yeah, so you remember arteria brachialis will also give off the deep brachial artery, and the femoral artery will give off the deep femoral artery. Yeah, arteria profunda femoris. And in fact, this is also quite frequently examined in the dissection exam. So make sure you use the seminars next week well to try to find it, because sometimes it's a little bit hidden between the muscles. But it's actually very clear, yes, because it's the only big branch that the femoral artery gives off. Yeah, so it will be this one here. So this is the deep femoral artery, arteria profunda femoris. Now, arteria profunda femoris will give off two branches, arteria circumflexa femoris medialis and arteria circumflexa femoris lateralis. So you have the lateral femoral circumflex and the medial femoral circumflex artery. The medial is the one that will go a little bit to the posterior direction, so this one right here. And the lateral will go, to the lateral side. And similarly to the circumflex arteries of the humerus, they will anastomose and form a ring around the bone. Yeah, so in this case, the femur, of course. Arteria circumflexa femoris medialis, so it's this one that runs to the back, has several branches. Most importantly, I would say, is this one, is the descending branch. So ramus descendens, ramus descendens, and ramus descendens will form anastomosis cruciforme. Anastomosis cruciforme, it means like cross-like anastomosis, and is formed by three branches. I'll try to show it to you. Like this maybe. Alright. And this is just the theory, yeah, so I don't think you can see it on the body specimens, but again, so we have ramus descendens, like this. Then we have arteria glutea inferior, it will be this one here. Oh, rip. So this one here, like that. And the first branch of the perforating arteries, so it will be this one. And they will all come together here in the middle and form, I don't know, it does not look like a cross to me, but apparently it did to the anatomists back in the day. So, anastomosis cruciforme. Cool. Now, that's about the medial femoral circumflex artery. Now, the lateral femoral circumflex artery will be this one, and it will have three branches. So, ramus ascendens, ramus transversus to the side, and ramus descendens. So that's all it. Then, important are rami perforantes. So, rami perforantes are perforating branches that will supply the posterior compartment of the leg. Because if you think about it, the only big artery, the femoral artery, runs in front of the thigh, approximately at least. So we do need a blood supply somehow for the back, and we don't have an artery there, but rather these perforating branches. Yeah, so these are all these small branches coming off from the arteria profunda femoris. Yeah, so this one here. Alright, so arteria femoralis will then continue further distally, medially from the femur, and enter canalis adductorius, or also called Hunter's canal. I won't explain what this is, otherwise this lecture is going already next week, or this week actually, with the muscles of the thigh. So canalis adductorius, it will enter, and before it leaves the Hunter's canal through hiatus adductorius. So remember, hiatus adductorius is formed between the both insertion points of musculus adductor magnus. It will give off arteria descendens genus, so descending artery of the knee, and you can see this artery nicely here. So it's going to be that one, arteria descendens genus, and it will form some articular branches and also ramus zaphanus. Ramus zaphanus will accompany nervus zaphanus. Now, after it appeared through hiatus adductorius on the posterior side, again, study this, please, on the body specimen next week in your anatomy seminar. So this is just to give you the theory behind it, and to really recognize it, you have absolutely to check on the specimen. But it's really easy to identify this artery. The only difficulty may be to differentiate it from the vein, and in the beginning also maybe from the nerves. But again, you can learn that in the seminars. For now, the femoral artery will become the popliteal artery. So arteria poplitea, in the popliteal fossa. So arteria poplitea is this one, right here. Also, if I speak too fast, just like let me know and I'll slow down. Alright, popliteal artery. Now you can see the segment of this popliteal artery is quite short actually, which is good for us because it means it's less to study. And I think the popliteal artery is actually one of the easiest or most logical ones because the names of the branches are really self-explanatory. So first we have the medial and lateral superior artery of the knee. Yeah? So arteria superior lateralis genus and arteria superior medialis genus. So superior means the superior, medial means medial, so on the left side of the screen, and lateral on the lateral side. Yeah, so it will be affect these arteries here. So arteria superior lateralis, medialis genus and lateralis genus, and the same name applies for the inferior arteries here. So yeah, so these ones here is arteria inferior. Arteria inferior lateralis genus, and on the contralateral side here, arteria inferior medialis genus. Now, in between these superior and inferior medial and lateral knee arteries, we will have arteria suralis. So the sural arteries will supply musculus triceps surae and also musculus plantaris. Yeah, so just as a repetition, musculus triceps surae is just a name used for musculus gastrocnemius plus musculus soleus. Now, another important artery is arteria media genus. Arteria media genus will supply ligamenta cruciata, yeah, so the cruciate ligaments, membrana synovialis of the knee joint, and in fact also the menisci. Yeah, so we have meniscus medialis and lateralis. So those are supplied by arteria media genus. Now, if we change to an anterior view, like this, we can see a network formed here of all of the branches of all of the arteries that I just told you, or like specifically number 1 and 4. They will form like a network, and this network is known as rete articulare genus. And supplies, as you can see, the patellar region of the knee. Alright, so that was arteria poplitea. Let's change back to a posterior view and see what happens next with it. So arteria poplitea will split into 2 main branches. So the first one will be the anterior tibial artery, and some of you might guess it, the second one will be the posterior tibial artery. Let's start with the anterior tibial artery, arteria tibialis anterior, so it's this one right here, and it will pierce through membrana interossea cruris. So membrana interossea cruris is a fibrous membrane span between the interosseous margins of the tibia and the fibula, and the anterior tibial artery will run anterior to this membrane, further distally. Now, it has recurrent branches, so an anterior and posterior recurrent branch. So this will be the anterior recurrent branch, and recurrence means recurrent because it goes up back again to the knee joint. So this is the anterior. This will be the posterior one. So actually, I'm sorry, this is probably this one here. Yeah, or maybe it's not depicted. I took the branches from the white book, and you should also study from the white book and the lectures. So while this complete anatomy, I'm a big fan of it, does show a lot, but it does not show everything. So go and stick with the white book. All right. Then it will give off some muscular branches, of course. So for the muscles of the anterior compartment of the crus, so namely musculus tibialis anterior and the long extensors of the foot. And distally, it will give off arteria malleolaris anterior lateralis and medialis. So if I zoom in here, so again, this will be the anterior tibial artery, and then this will be the lateral anterior malleolar artery, which will form anastomosis with the posterior malleolar artery and form again a network rete malleolare laterala, and the same thing is true also for the medial side. So if we look at the different sides here, so this is now the other foot, tibial artery is coming down here, and these are medial malleolar arteries. So the continuation of arteria tibialis anterior will be arteria dorsalis pedis, so it means the dorsal artery of the foot. And this one is really important clinically because it is a frequent site of palpation for pulses. And sometimes it's quite hard to find it and to palpate it, so therefore, if you know the anatomical positioning and direction of it, it will be a great advantage and you will have higher chances to find it. Arteria dorsalis pedis, so therefore it's important to know that it runs towards the first intermetatarsal space, so spatium intermetatarsale primor. It's just a fancy word for the space between the metatarsals, so this is the first intermetatarsal space here, then we have the second, third, and fourth. Alright, so the dorsal artery of the foot will give off medial and lateral tarsal arteries. So in fact 2 to 3 medial tarsal arteries, which will supply, of course, the tarsals as the name says so, and one lateral one, which runs laterally and distally, so it will be this one. And it will anastomose with this artery here. This is arteria arcuata. Arteria arcuata is a transverse artery that runs approximately over the Lisfranc joint. So Lisfranc joint, and connects both the dorsal artery of the foot together with the lateral tarsal artery. Now, arteria arcuata is also the origin of the dorsal metatarsal arteries. So arteria metatarsalis dorsalis are these ones. They will run in the interosseous space. Like here. And they will give off to the arteria digitalis dorsalis pedis. So it means the dorsal digital arteries of the foot, supplying the digits of the foot. Alright, so then let's return to a posterior view and see what happens with arteria tibialis posterior. So arteria tibialis posterior will be this one here. And the first branch it will give off is ramus circumflexus fibularis. And again, I think by now all of you should be familiar with what circumflex means. It just means it's like going around, or like flexing around, I guess. And you can see it also here nicely. It will flex around the head of the fibula. So that was therefore ramus circumflexus fibularis. Then important, arteria fibularis. So arteria fibularis is a branch of the posterior tibial artery. It is not an own branch from the popliteal artery, usually. So arteria fibularis enters then the muscular fibula canal and descend in it and give off rami muscularis and rami perforantes to supply all of the muscles of the lateral compartment, but also the posterior compartment. And distally, it will form rami calcanei. So this is the fibular artery. You can see it nicely, the relation to the fibula. And if I were to put in the muscles, you can also see the muscular fibula canal, but then you wouldn't see the artery. Fibular artery will form calcaneal branches to supply the calcaneals, and also posterior lateral malleolar branches to supply also rete malleolare laterala. Again, rete malleolare laterala is just the network formed by all of the contributing arteries. So not that important, I would say. Alright, but the actual posterior tibial artery will descend down and give off again also some branches to the posterior compartment muscles, and distally will run behind the medial malleolus here, to divide in its two terminal branches, the medial and lateral plantar artery. So arteria plantaris medialis and lateralis. I'm sorry, this is a weird view, but I hope you get me. So again, posterior tibial artery, and then medial plantar artery is this one here. This one here, so medial plantar artery, and lateral plantar artery will be this one that goes to the lateral side and forms this interesting arch. All right, so let's start. I think, yeah, okay, with lateral plantar artery. This is now a plantar view of the foot, and you can see here that the lateral one is directed towards the base of the fifth metatarsal, and it will then continue as arcus plantaris profundus. Yeah, so again, there's some similarity to the vessels of the upper extremity. There we had the deep and superficial palmar arch. Here we just have the deep plantar arch, and it is the continuation of the lateral plantar artery. Now, arcus plantaris profundus will give off perforating branches, which will transverse the intermetatarsal space. So these ones here, yeah, and will anastomose with arteria arcuata. Yeah, so arteria arcuata was the one above the distal joint, and it is also the source for the plantar metatarsal arteries. Sorry, the long ones here that you can see that will run towards the digits, and they will split up into the common plantar digital arteries, which will then split up again into the proper. Oh, that was a little too far. Into the proper digital arteries. Yeah, so you can see here the bifurcation. Okay, so that was the lateral artery, lateral plantar artery, and this deep plantar arch will also anastomose actually with the medial plantar artery. But the medial plantar artery has much simpler course. It will run between musculus abductor hallucis and musculus flexor digitorum brevis. So you know already from this week, those are muscles of the superficial group in the foot, and between that you can usually find arteria plantaris medialis. It will supply the medial side of the foot, the hallux, and again anastomose with the deep arch. Okay, I think that's it for the arteries. Don't worry, the veins now will be much quicker and shorter. The arteries usually take a big part of it, a big time chunk. But yeah, I hope that was everything and everything was clear. If you want to revise it, get an atlas and look at it, read the white book. Have the white book next to you and read through it and try to find all of the branches in the atlas, and really try to have a good understanding of how everything works, because a good knowledge and imagination of the theory will make it much more easier for you in the practice or in the seminar or in the dissection exam to find the structures and recognize them. Yeah, because you've all seen the body specimen; they all look dry and everything has the same color. So it's really important that you can kind of see your way through that, and the best way to do that is by having a good theoretical knowledge and foundation. All right. Now, the veins. Let me just put on the veins in our model here. All right. All right, so veins generally. Alright, so veins generally transport the blood from the periphery back to the heart, yeah, so in the opposite direction than the arteries. And this is also important that you know that, and that you also apply it, yeah. So do not say that, I don't know, the femoral artery, the femoral vein will branch into the popliteal vein or something, or the popliteal vein will branch into the posterior tibial and the anterior tibial vein. But it's vice versa, yeah? And you also have to show the examiners that you understand that. So while arteries have branches, veins are formed by contributors. Yeah, so we'll go through some examples here, but please keep that in mind, and examiners don't like to see that that you say like with branches and that you like confuse the direction of blood flow. And another thing that is important to know is that there's a high variation in the venous system, yeah, unlike the arterial system. Especially this is true for superficial veins. So in fact, many superficial veins don't even have names because they were so variable that and inconsistent that they were just not named, or just named like unnamed vein, or like unnamed contributor of the greater saphenous vein, for example. So don't worry about them. But of course, there's some structure to it, and the large ones you will definitely have to know. And generally, we can divide the arterial system, the venous system in the extremities into a deep and a superficial venous system, which are both connected by various perforating veins, as we will see. And yeah, let's get to it. Again, it will be a little bit shorter than for the veins. All right, cool. Okay, and because the blood collection starts at the periphery, we will also start in the periphery, and we will start with the arcus venosus plantaris profundus. Yeah, so arcus venosus plantaris profundus. And oh yeah, generally, so these are deep veins now. What I forgot to say, the deep veins will actually follow the course of the arteries. So if you know the arteries, you basically also know the course and mostly also the names of the deep veins. So this is true for arcus venosus plantaris profundus, because you can see it is literally just behind or close to the arcus plantaris profundus, the arterial one. Yeah, so the artery, and here's the vein. And this arcus venosus plantaris profundus will drain the same vessels that also have the arteries as a branch for the deep plantar arch, if that makes sense. That was a long sentence, but basically, you remember we said the plantar metatarsal arteries are a branch of arcus profundus plantaris. So therefore, also vena metatarsalis plantaris, so plantar metatarsal veins will be drained by this venous arch. And vena metatarsalis plantaris itself will drain vena digitalis plantaris, again just opposite to the arteries. And again, just opposite to the arteries, it will continue as vena plantaris lateralis. Yeah, so it will be this one here. So this is the. I mean, you know now what the lateral plantar artery is, yeah, so I don't have to point it out again. And then you also know what the lateral plantar vein is. Hope that is clear. Now, we also have similarly, we have vena plantaris medialis, and both of them will confluent to join together and form posterior tibial veins. Posterior tibial veins, again, it is just opposite like the arteries. So it's really, the deep veins are actually quite easy. There's a few exceptions, but mostly this applies. Now, another thing to know is that the deep veins are usually paired. So you can see here in the middle of the posterior tibial artery, and left and right of it, it is accompanied by posterior tibial veins, which has a few benefits physiologically. So you will study it next year. All right. So the posterior tibial vein will ascend along the artery. Let's follow its course up, and like the artery, it will receive some branches from the muscles. So posterior tibial artery is this one, the pink one here, and it will receive the fibular vein. One. Yes, no, wait, I'm confused. This one here, yeah. So we had you can see like the fibular artery just below it, and it will form vena popliteal together with the anterior anterior tibial vein. Yeah, so again, it's just like the arterial system. Usually, yeah. So again, in the venous system there can be some variations, but usually the fibula veins will drain into the posterior tibial veins, and then vena tibialis posterior plus vena tibialis anterior, poplitea. Now, vena poplitea will again receive the same branches like the arteries gives, or it will receive the same contributors, yeah, or has the same contributors than the artery has branches, to put it in the correct way. Additionally, vena poplitea may receive this vein here. It is one of the superficial veins. Yeah, so this is one of the slides I was talking about, the connection in between them. So this is the lesser saphenous vein. Yeah, so vena saphena parva. But vena saphena parva we will discuss in a second. And vena poplitea will then transverse the Hunter's canal, just like the artery, and then will continue as vena femoralis. So then let's continue with vena femoralis, femoral vein. Let's zoom out a little bit and switch to the anterior aspect. So femoral vein is this one here, yeah. So it's quite a large lumen vessel, and yeah, never mind. All right. So vena femoralis will receive vena femoris profunda, again analogically to the artery, and also vena circumflexa femoris, which may drain also directly into the femoral vein, but usually to the deep femoral vein. Now, then there is also the confluence of the greater saphenous vein, yeah, so vena saphena magna, in a special place called hiatus saphenus. Yeah, so this is the greater saphenous vein, and you can see here it drains to the vein. And while we edit, actually, let me show you here and stress and highlight this relation of the vein, vena femoralis, and arteria femoralis. The vein is medially to the artery, yeah, so remember this. And this is also how you can differentiate both of them or one of the ways how to differentiate them in your anatomy seminar next week, or also in your dissection exam. Yeah, so the vein is always medially from the artery. It's one of the criteria how you can identify and differentiate both of them. There's several other ways you can ask your teaching assistants in anatomy if you have some, or of course always your seminar teacher. All right. So vena saphena magna in hiatus saphenus. Yeah, so hiatus saphenus is a weakening and opening in fascia lata. I thought I would have a picture. Oh yeah, here. We'll discuss it with the greater saphenous vein. Never mind. All right, and vena saphena. The femoral vein will enter the abdomen via the also lacuna vasorum, yeah, together with the artery. All right, and just like we have it for the arteries, the rami perforantes, we also have vena perforantes. So it is really the same thing. But in the veins, it will also include just the connection of superficial veins with deep veins. Yeah, so the deep veins have a greater lumen, so therefore the blood drainage is better there. So there's a lot of perforating branches, and it has of course also some clinical importance that you can read through it. I don't know, maybe I'll post like the presentation somewhere and you can read through it. Let's continue for now with the superficial veins. Now, superficial veins are mostly, or actually all of them, I think, yeah, all of them, in the subcutaneous tissue, and those are the ones that you can also see, yeah, from the outside. Yeah, so let's start with the dorsal digital veins. So dorsal digital veins will be those ones here. They will confluent to vena metatarsalis dorsalis. Yeah, so these ones here, collecting vessels, which will then form rete venosum dorsale pedis. Yeah, so the venous network of the foot, of the dorsum of the foot, and it is actually the analog of rete venosum dorsale manus. Yeah, so you remember it maybe from last week. Now, on the plantar side, we have vena digitalis plantaris, which will drain via arcus venosus plantaris. Yeah, so it's the one that will continue as the lateral plantar vein. Alright, now those are really important veins. Yeah, so vena saphena parva and vena saphena magna. Now, vena saphena magna is actually the longest vein in the human body. Let me show you its full extent. It is this one here. Yeah, so you can see it really goes from the foot all the way up. It's just one vein, and it's really huge. Yeah, so it's also interesting for us clinically. Anyway, so vena saphena magna will start off as vena marginalis medialis. Yeah, so vena marginalis medialis, or medial marginal vein, will be this one here. Again, this is also superficial, and will drain the medial side of the foot, will have connections to rete venosum dorsale pedis, and will continue as vena saphena magna. Yeah, so please make this association, vena marginalis medialis and vena saphena magna, because vena saphena parva will originate or come from vena marginalis lateralis. Yeah, but I think it's actually nice to remember, because vena saphena magna drains marginalis medialis. Yeah, so triple M. Alright, now another association I want you to make is that it will be accompanied by the sural nerve, yeah, nervus suralis, while vena saphena parva will be accompanied by nervus suralis. Oh, sorry, maybe I just messed it up. So nervus saphenus. Yeah, so vena saphena magna will be accompanied by nervus saphenus, and vena saphena parva, lesser saphenous vein, by the sural nerve, nervus suralis. All right. So vena saphena magna will ascend on the medial side of the leg, and here you can see, like the ones I spoke about earlier, all of the unnamed contributors of the saphenous vein. They don't have a name. They're just called like unnamed contributor of greater saphenous vein because they're so variable. Now, vena saphena magna will drain into vena femoralis, yeah, directly into the femoral vein through a specific site called hiatus saphenus. So hiatus saphenus is an opening in the fascia lata, and now I can show you the picture. So this is an anterior view of the right leg. Here you have the fascia, all of the white thing. So the superficial layer was dissected, and we will see this. And this opening here, you can see, is like a gateway to the deeper structures, mainly the femoral vein. And also, because it looks like a star here, this is also known as like the Venous star or hiatus star, because like all superficial vessels will transfer or pass through here. So hiatus saphenus. Okay, cool. Yeah, so here we have vena saphena magna, and it will drain into it, and it will also receive, for example, the superficial epigastric vein. But let's go back to this one. Yeah, so vena saphena magna. So vena saphena magna will also receive vena pudenda externa. Yeah, so it will be from the medial side. It's one of the early medial contributors of the greater saphenous vein. And also vena epigastrica superficialis. Yeah, so vena epigastrica superficialis is, let me see, it is this one running together with the superficial epigastric artery. Yeah, and in this one, actually, again, high variation. So in this one, this vein will drain directly into the femoral vein. But usually the most common variation is actually that it will drain first into vena saphena magna, and then vena saphena magna drains into vena femoralis. Yeah, and also the white book states it that way. So at least, like, the minimal knowledge you have to know is the lectures. Yeah, let's start there. So the lectures are really the minimum level you have to know to pass the anatomy dissection, the anatomy exam. Now, if you want to step up your game, white books, yeah, but even for like the basic ones, I will recommend white books. Without white books, it's going to be very hard. Also demonstrations, And so if the white book says vena epigastrica superficialis will drain first into vena saphena magna, you have to know it that way, yeah? Of course, now that you know that there are variations and that it may drain into vena femoralis or that it may drain into vena saphena accessoria, you can say that also in the exam, yeah, they will be impressed. But please just remember, minimally it will drain first into vena saphena magna, and from there it will go to the femoral artery vein. Alright, so this is the greater saphenous vein. We also have a lesser saphenous vein, so vena saphena parva. Vena saphena parva again starts on the lateral side as vena marginalis lateralis. So let me show you. So it's this one here. Oh no, where is it? Yeah, that one here. So the program is a little laggy with all of this stuff running in the background, but alright, perfect. So this one. Yeah, and you can see it will continue behind the lateral malleolus and ascend, again, this is superficial vein, yeah, so it's actually not directly behind the malleolus, and will ascend in the posterior compartment. And vena saphena parva, you have to associate, yeah, of course, you already know now, vena marginalis lateralis, but please associate it also with nervus suralis and musculus gastrocnemius. Because if I put on the muscles here quickly, you will see that it will run really between both of the heads of the gastrocnemius muscle. And this is really serves for you as an identification criteria that you can easily use to identify it 100% sure as vena saphena parva. So you see here caput mediale and caput laterale, musculi gastrocnemi, and this will be vena saphena parva. And if I put on the nerves here, we should also see a nerve running with it, so that will be the sural nerve, nervus suralis. Yeah, so you can see it here, the yellow nerve, the yellow structure here and here. So there's a close association with that nerve, and be sure to remember it. Alright, now let's get rid of the muscles so we can see the vessels again. Oh, no, alright, perfect. And what happens with vena saphena parva? So, again, usually, and the white book says that it will drain to vena poplitea in the popliteal fossa, but it can also drain into other veins. Yeah, but let's say, yeah, so vena poplitea. Alright. And I think this is it for the superficial veins. Yes. Yeah, so that's it. Really, so basically remember for the deep veins is mostly like for the arteries, and for the superficial veins you have vena saphena magna and parva, and yeah, these, but really the most important ones are saphena magna and parva. Alright, anything else we can see here? Yeah, maybe some lymph nodes, but yeah, alright. Okay, so before we make a short break, let's just quickly go through the lymph vessels. This will be very short because it is actually not a lot. Yeah, so many students don't study the lymph nodes or lymph vasculature, which I mean, not gonna lie, it was the same for me. Yeah, I tried to put it off to the back and not really study it, but I can highly recommend you to do it because, like, one of my friends, for example, got a lymph node question in his final examination, in his final oral examination, and you just do not want to mess up in that one. Yeah. So, and compared to all of the rest of anatomy, of neuroanatomy, of visceral anatomy, even like osteology, arthrology, really the lymph vessels are not that much of an extra load. Yeah. So do them, and they're also not too hard. If you follow it by the white book, it's actually quite simple. I mean, you don't have to know really every lymph node, yeah, but the most important ones you have to know because it's also clinically relevant, yeah. Especially, for example, the lymph nodes of the axilla or the inguinal lymph nodes that we'll discuss now. So those are really important. All right. So generally, lymph is a like clear structure, clear fluid, and it will be drained from the tissues back into the bloodstream. And so therefore it is a unidirectional flow system, unlike the systemic circulation with arteries and veins. As the name suggests, like it is a circulation for arteries and veins, the blood circulates. For lymph vessels, it is a unidirectional flow because it will flow from the periphery and drain into the venous system, back into the circulation. Now, histologically, they are of similar structure that are like veins. There are some subtle differences, but you will study those in histology. What else is important for us? Yeah, so the lymph vessels are interrupted by so-called nodi lymphoidei, or also nodi lymphatici, or in English, lymphoid nodes or lymph nodes, just lymph node, I think, lymph nodes, and anatomically they serve as a point of convergence, we can say. So that means we have multiple vasa afferentia. So let's say, for example, 10 vessels, not 10, maybe 8 vessels going or draining into one lymph node, and then from that lymph node only one vessel will go out. Yeah, so by that we have a high convergence of maybe, I don't know how many hundred of, or maybe like several hundred to thousand small lymphatic vessels will be converged really ultimately to two main ducts, which will drain into the venous angle, yeah, angula venosa. But you will study that later. Yeah, so just know now for now it's unidirectional, and I mean the concept of lymph is probably not new for you. I just realized because you studied it for the about extremity already, so let's just go right into it. Now, we can divide the lymph vessels in the leg in a deep and superficial system. The deep lymphatic vessels, just as the veins, they will continue with the arteries. Yeah, so actually most of them will run like in a little triad. So artery, vein plus lymph vessel. But usually they are too small, or like definitely they're too small to be visible on the specimen. Yeah, so don't look for them; you won't find them. Now, the lymph vessels are interrupted in the leg by two important lymph node stations, and these are the deep popliteal lymph nodes, yeah, so nodi lymphoidei poplitei profundi, and the deep inguinal ones. Yeah, so these you have to know. About the others, I would say don't worry, but of course, the more you know, the better, as always. So the deep popliteal lymph nodes lie deep to the vessels in the popliteal fossa. I'll try to show them to you, but actually is just for illustration. Yeah. So again, you won't find any of these in the specimen. Maybe some lymph nodes, but yeah. Yeah. So here you have the deep popliteal lymph nodes. Deep popliteal lymph nodes, which will drain the lymph from the crus, yeah, so the lower leg, and also the knee joint. Now they will continue proximally, yeah, together with a femoral vein and artery. And another important lymph node station will be the deep inguinal lymph nodes, yeah, so nodi lymphatici or inguinal, nodi lymphoidei inguinalis profundi, and they will lie in the inguinal region, medial to the femoral vein. Yeah, so here we have the femoral vein, and medially to it we can find the deep lymph nodes, deep inguinal lymph nodes. Yeah, so they lie medial to vena femoralis, okay, and they will drain the lymphatics actually from most of the leg, including the clitoris or glans penis. Yeah, and an important lymph node here is the Clockett's lymph node or Rosenmüller lymph node, which is just an eponym, yeah, so a different name for the deepest of the deep inguinal lymph nodes, yeah, so it's usually the one most superior. You can find it between the angle, I don't know, maybe I have a picture here, do I have a picture here? No. Yeah, we can use this one, I guess. So you can find it between the angle of ligamentum inguinala and vena femoralis. Or wait, let me Yeah, so this is important. This is why I'm stressing it, because the Clockett's lymph node you can actually sometimes find. Okay, I hope this is not going to be a mess. It's already messy. So ligamentum inguinale is, maybe let's not use blue, but I don't know, black. All right, so ligamentum inguinale, you know from arthrology, runs from spina iliaca anterior superior, somewhere in there, to tuberculum pubicum. Yeah, so like this, and vena femoralis you have here, like that, and then you have the angle between both of these here, and this is where you'd find the Clockett's lymph node. Yeah, so you can try to find it in the specimen or during the dissection exam. This is the Clockett's lymph node or Rosenmüller lymph node. All right. Cool. And that's it for the deep lymphatic vessels. So let's continue the superficial lymphatic vessels. The superficial lymphatic vessels, we have two tracts, the medial lymph tracts and the lateral lymph tracts. The medial ones are more numerous, but yeah, so you can see here, it's really more medially. And the reason for that is simple. If you look at it, most of the vessels are actually also on the medial side. Yeah, and with vessels, we also, you'll learn this in physiology, not only supply nutrients and oxygen to the tissue, but actually some of the fluid will also leak into it, and this extra fluid will partly be reabsorbed by the lymphatic system. Yeah, so therefore it makes sense. Wherever we have a lot of we have a high perfusion, we also have a high lymph drainage. So therefore, medially we have more. All right. The medial lymph tracts will drain into the superficial inguinal lymph nodes. Yeah, so nodi lymphoidae inguinal superficialis. So these are the large ones that you can see here and here, and those laterally mostly. Yeah, so mostly lateral to the vein, and of course superficial. Yeah, so there's different classifications and divisions for it. The white book uses proximal group and distal group, so let's just stick with that. And the proximal group of superficial inguinal lymph nodes will drain the external genital organs, the perianal region, infraumbilical region, and parts of the uterine vessels, while the distal group receives basically all the lymph of the leg except for the posterolateral lower leg. Yeah. And this includes also the lateral vessels. Yeah, so the lateral vessels will drain also into that nodi lymphoidae superficialis, and also nodi lymphoidae popliteae superficialis. Yeah, so just like the deep popliteal lymph nodes, we can also see some superficial ones. So okay, here we can't see them, but imagine them. Yeah, so we have deep ones and also superficial ones. All right, now before we start with the nerves of the lower extremity, we can take a break. Let's do like 5 minutes or so. You can, I don't know, get a snack or something. You can write some questions in the chat, or you can use the time to answer these practice questions, and I'll be back in 5 minutes. So just like the deep popliteal lymph nodes, we can also see some superficial ones. So okay, here we can't see them, but imagine them. Yeah. So we have deep and also superficial ones. Alright, now, before we start with the nerves of the lower extremity, we can take a break. Let's do like 5 minutes or so. You can, I don't know, get a snack or something. You can write some questions in the chat, or you can use the time to answer these practice questions, and I'll be back in 5 minutes. Co to jest? Alright, let's continue. So yeah, I hope you had a chance maybe to look at the practice questions. I'll put them back on again at the end of this presentation. Otherwise, you can also quickly do a snapshot. screenshot. You can do a screenshot of the answers if you want to compare them later. So it's once again questions here and answers here. Alright, now let's continue with the nerves. The nerves. This is actually quite a huge topic, so I'll try to be as quick as possible, but of course some things have to be said and done. Now, just like in the upper extremities, nerves of the lower extremities originate from a plexus. So where we have the brachial plexus in the upper extremity, we have mainly the lumbar and sacral plexus for the lower limb. So it's two plexuses, yeah, but actually because they're interconnected somehow as well, they're also sometimes usually referred to as the plexus lumbosacralis, yeah, so lumbosacral plexus. Now let's start with the first one, plexus lumbalis. So it is formed by the spinal nerves rising from the level of T12 to L4, and the plexus is located in musculus psoas major, yeah, so deep in it. So we can actually really see, like, you know, in the brachial plexus we saw, like, I don't know, like fasciculus, truncus, and so on. And here we can only see really the 6 main branches that will come out at the end, yeah, so these ones here. And plexus lumbalis, in fact, also has some direct nerves supplying some of the viscera and also muscles of the abdomen. All right. Sorry, but let's focus Let's focus on the nerves supplying the lower leg, which are these ones. Yeah. So iliohypogastric, ilioinguinal, genitofemoral nerve, lateral cutaneous femoral nerve or lateral femoral cutaneous nerve, femoral nerve, and obturator nerve. And just because I fucked up a little bit here with nervus cutaneus femoris lateralis, the English one, let me just tell you, I don't know if somebody's told you, but you can choose, yeah? So you can choose between the English terminology and the Latin terminology. And you can also choose, like, in between different terms. But you have to understand both. Yeah, so you have to understand both, this is one thing. And also within one term, you have to stick to one actual nomenclature. Yeah, so do not, I don't know, mix it up, yeah? So anatomy is also about the names or correct names, and not only about the structures, which obviously is the largest part, but so choose for yourself Latin or English nomenclature. I chose mostly Latin one, yeah, so nervus cutaneus femoris lateralis, and the English one is mostly just backwards, yeah, so lateral femoral cutaneous nerve. Alright, so here is an overview about the nerves of the lumbar plexus. On the left side, the muscles preserved the psoas major muscle, so this one, while on the right side here, it was removed. So you can see here musculus iliacus, musculus iliopsoas, and musculus psoas major was cut, and this only allows us to see, like, all the mixing of the nerve fibers. While in situ, in the living person, we would find musculus psoas major, of course, and then only the terminal branches, yeah? So iliohypogastric is the most superior one. Below that, ilioinguinal, then lateral femoral cutaneous, genitofemoral, femoral, and obturator nerve. So let's start from top to bottom with iliohypogastric. So nervus iliohypogastricus arises mainly from L1, partly also from T12, and crosses to the lateral side just anterior of musculus quadratus lumborum. So this is one of the abdominal muscles that you will study next semester, I think. I don't know. And also just inferior to the inferior pole of the kidney. Yeah? Polus inferioris means inferior pole of the kidney, and this relationship is also important because on the kidney we can also see sometimes an impression actually of this nerve. Now, then it will run above crista iliaca and will pierce musculus transversus abdominis. Yeah, so we can, I don't know if we can see it here, yeah, so perfect. So this is musculus transversus abdominis, and the iliohypogastric will pierce this nerve and then run between the musculus transversus abdominis, the innermost layer, and musculus obliquus internus, which is the middle. Yeah, so the abdominal wall, we have three muscles. Musculus obliquus externus is the most superficial one. In the middle, we have this one, internal oblique, sorry, and the innermost one is the transverse abdominal muscle. Sorry, and actually, an interesting fact is because of the embryological development, you can find this pattern throughout the whole body, actually, or like at least the trunk and neck. So the nerve and the vasculature will always run between the innermost and the middle or intermediate muscle layer. Yeah, so it means for the like you from the first year, you don't have to know this for now, but I know maybe that there are some repeats watching. So for you, if you think about the intercostal nerve, in the intercostal nerve and also the intercostal vessels, they will also run between the innermost and the intermediate muscle layer of the thorax. Or actually also in the neck, so there we have musculi scaleni, musculus scalenus anterior, medius and posterior, and there the plexus brachialis is between the anterior most and between the anterior and the middle scalenus muscle. Yeah, okay. Never mind. Just wanted to mention it. Then, yeah, we already said it will run between musculus transversus abdominis and musculus obliquus internus. Will have sometimes, or actually quite often, connections to the ilioinguinal nerve and terminate in the suprapubic region. Yeah, suprapubic region, and will supply it or innervate its somatosensory. So as to the branches, we have some rami muscularis. Of course, it runs between two muscles, so these two muscles are actually also innervated by this nerve. So musculus transversus abdominis again and obliquus internal muscle. Then we have ramus cutaneus lateralis, which will supply the posterior lateral region of the glutes, of the glute skin region. And we have ramus cutaneus anterior, which will supply the suprapubic skin region. Yeah, so suprapubic means just above the symphysis pubis. Yeah, that's it. Alright, that's the iliohypogastric. Next one will be ilioinguinal nerve, just below it. And you can see both of them actually come from, arise from this tendinous arch here, together with the subcostal. Again, you will, if you study the diaphragm, you will also get to repeat the arch, or like learn about the arches, and then you can also repeat like where the nerves exit. Alright, ilioinguinal actually is below it. It will run below it and will also enter or pierce through the transverse abdominis muscle. However, a little bit lower and closer to the crista iliaca, as you can see here. So, arises from L1, partly also from above and below, and emerges from the lateral border of musculus psoas major. Yeah, so I put everything in red that will help you to identify it in the body specimen. Yeah, because in the body specimen it does not look like this. Yeah, it's usually really, everything's necrotic, dark, and dry. So I'll try to give you some points how you can find it in the body. Alright, we already said it will run inferior to iliohypogastric. It will also pierce transverse abdominal and run between it and internal oblique, and it will enter canalis inguinalis. Yeah, so the inguinal canal. It will enter the inguinal canal, where you can find it again also. Yeah, so if somebody shows you a nerve from the inguinal canal, keep in mind it could be the ilioinguinal, and it lies inferior to funiculus spermaticus. So funiculus spermaticus is a spermatic cord or the round ligament of the uterus, and will again terminate in multiple sensory branches to supply the root of the penis and also the proximal medial thigh region, as well as the ramus scrotalis, for the scrotum, or the labia majora, and also mons pubis. And just like iliohypogastric, it will also have some muscular branches that will supply both of the muscle that it runs in between of. Yeah, so musculus transversus abdominis, musculus obliquus internus. That's it for this one. All right. Next one will be the lateral femoral cutaneous nerve. So, nervus cutaneus femoris lateralis. It will also emerge from the lateral side of the psoas major, but really what is setting it apart is its course over musculus iliacus. Yeah, so this is one. And secondly, it is more or less really straightly running towards spina iliaca anterior superior. Yeah, so if you have any nerve that runs obliquely across musculus iliacus directly towards spina iliaca anterior superior, you can be really sure that it will be the lateral femoral cutaneous nerve. Where is it? One. Oh, okay. So we skip. Yeah, so never mind. So nervus cutaneus femoris lateralis. It will arise from the medial border of psoas major, obliquely over iliacus muscle. Yeah, so this should also be read towards spina iliaca anterior superior, and it will exit through lacuna musculorum. Yeah, lacuna musculorum together with the iliopsoas muscle. The major branches, it has an anterior and posterior branch. Yeah, so ramus anterior, ramus posterior. Anterior branch will supply the anterolateral thigh. Yeah, so there's somatosensory innervation, and the posterior branch is for the lateral thigh region. Yeah, so in the extent from trochanter major to approximately half of the femur. So that's the lateral femoral cutaneous. Yeah, this one here. Yeah, so you can see it exits below this inguinal ligament, laterally to the iliopsoas muscle. All right, now nervus genitofemoralis is this one, and you can identify it easily because it comes directly. It appears on the ventral surface of musculus psoas major. Yeah, it is really unique in that way, and it will also divide here into its two branches. So genitofemoral nerve will have a genital branch and a femoral branch. Yeah. So nervus genitofemoralis arises from L1, L2, anterior surface of musculus psoas major, and its two main branches is ramus genitalis and ramus femoralis. Now, ramus genitalis nervi genitofemoralis will actually also enter canalis inguinalis. Now, so you have two nerves running in the inguinal ligament, in the inguinal canal. So you have ilioinguinal nerve, and you will also have the genital branch of the genitofemoral nerve. Now, how can you tell them apart? The genital branch will run deeper to the spermatic cord or the round ligament of the uterus, while the other one is more posterior. Oh, sorry, inferior. Yeah, one is inferior. All right. Yeah, then this genital branch will course along the spermatic cord or round ligament of the uterus to exit in the superficial inguinal ring, annulus inguinalis superficialis, and there give off its terminal branches. Now, ramus femoralis will stay with arteria iliaca communis and later externa to leave through vasa femoralia. Leave through lacuna vasorum together with vasa femoralia. So it means arteria femoralis and vena femoralis will both go through lacuna vasorum, and you can find it as together there with the femoral branch. So this is how you can also find it in the dissection or in the body specimen. It will run together with the femoral artery, the iliac, common iliac and external iliac artery. Now, ramus genitalis will supply the scrotum, or labia majora and mons pubis. So similarly, like the ilioinguinal one, and this is also really important. It has a motor function. It will supply motor function to musculus cremaster. So you can actually clinically test the cremaster reflex which is a reflex that if you scratch the skin of the anterior medial thigh, which is supplied by ramus femoralis, that you can induce a contraction of musculus cremaster and thereby see how the scrotum is contracting. All right. Yeah, so this is another view of the area. So we have musculus psoas major here, and again, the only branch leaving from the anterior side is the genitofemoral one, this one here. Now, the point of division into the femoral branch and into the genital branch is highly variable. So sometimes it's really just only a few centimeters before the inguinal ligament, and sometimes they already come out as two separate nerves. So keep that in mind. If you have two nerves coming out of the psoas major from the anterior side, it can already be the branches. So you have to follow it more distally and see whether it goes through lacuna lacuna vasorum, or if it enters the inguinal canal. So this is how you can tell them apart. Alright, then nervus femoralis. So nervus femoralis is the largest nerve of not only this plexus. Sorry, I was going to say it in the body, but it's not. So it's the largest nerve of this plexus, and and you can easily identify it because it lies always between musculus iliacus and musculus psoas major. So it's in between both of these, and therefore it will also exit in lacuna musculorum. So in the muscular lacunae. So this is really important. Keep this in mind. So nervus femoralis will leave through lacuna musculorum because it lies between musculus psoas major and musculus iliacus. So this is a straight up fail question. If you don't know this in your dissection exam, they will not ask you another question. You fail if you don't recognize this one. While if you, don't recognize iliohypogastric or ilioinguinal one, or maybe even lateral femoral cutaneous nerve, they will ask you some other questions. But really, femoral nerve or obturator nerve, those are questions they will immediately fail you if you don't know that. Alright. Pharyngis around L2 and L4, this is also really important. L2, L4, from the lateral border of musculus psoas major. Then descends between both the muscle we spoke about, lacuna musculorum, check also. Gives off many sensory branches. It gives off many sensory branches after it has left the. Let me just switch over here to show you. So there are many sensory branches for the sensory innervation of the skin, mainly, and also the hip joint. And it will have one major branch, and that will be the saphenous. The saphenous nerve, so that was saphenous. And now you should already be thinking of also a vein, because it has a close relationship in its course with the vein. So is it vena magna or vena parva? You can let me know in the comments. Alright, so femoral nerve is this big boy here. This one. And you can see it exits under the inguinal ligament and then give off really numerous and plenty sensory branches to supply the anterior compartment. Alright, and the sural nerve, saphenous nerve will be, so for that it's not so good, For nerves it's not the best, but I hope you saw it. Alright, nervus saphenous is given off. Nervus saphenous is given off and will descend together with arteria femoralis and also enter canalis adductorius. But unlike the femoral artery, nervus saphenous will leave early of the canal, through by piercing through lamina vasoadductoria. So lamina vasoadductoria is the membrane that will form this Hunter's canal together with its three muscles, and it will descend with vena vena magna. So this is the answer to the question. Vena vena magna, nervus saphenus. Now, nervus saphenus will give off also some branches, so infrapatellar branches to supply the patella and also the knee joint, while and then it will terminate as rami cutaneae cruris medialis to supply the skin of the medial lower leg. Now, femoral nerve, you already know from the muscles from this week, it is innervating several muscles, mainly the muscles of the anterior compartment, and also iliopsoas, of course, runs between both of these muscles, so it will also supply them. So musculus iliopsoas, pectineus, quadratus femoris, and sartorius, and its anterior cutaneous branches will supply the anterior side of the thigh. So this is what I was talking about, the plenty and numerous sensory branches of the femoral nerve. Alright, here we can see a cross-section of the lacunae. So we have ligamentum inguinale, which will again connect tuberculum pubicum with spina iliaca anterior superior, and below the bony part and this inguinal ligament, we can find two spaces divided by arcus iliopectineus. I don't know if you can see my mouse. Let me put on the laser point again. So arcus iliopectineus will divide it into two spaces. We'll have one space here. This is known as lacuna vasorum, so lacuna of the vessels, and lacuna musculorum. Now, in lacuna musculorum will exit musculus iliopsoas, together with nervus femoralis that you can see here, and on the very lateral spectrum of it, nervus cutaneus femoris lateralis. So this is the one I was speaking about earlier. This leaves through there. Now, then we have lacuna vasorum, is for the vessels, so artery and vein, and nervus, and this nerve here, so ramus femoralis, of the genitofemoral nerve. So the big structures here will be nervus femoralis and arteria femoralis and vena femoralis, and please remember this pattern. So most medially will be the vein, laterally of that the artery, and most lateral will be the nerve. So this is really important. All right, and here you can also see the Clockett's or the Rosenmiller lymph node, which lies again in the angle between the vein and the inguinal ligament. So this is the location. It was also a practice in the quizzes. Here you can see it nicely. All right. Perfect. Here you can see also all of the branches of the femoral nerve and the saphenous nerve going down here all the way down here. So it's really, if not the longest nerve, I think it is the longest nerve of the body. I would need to double check on that, but I'm pretty sure actually. So nervus oralis. Nervus saphenus. So infrapatellar branch, and here is cutaneous branch. It will supply the medial side and also the medial side of the foot, which again makes sense because again it is closely associated with vena vena magna, and vena vena magna starts as vena marginalis medialis, so makes sense. Everything comes together. Hope you get it. Let's move on. Now, next nerve is nervus obturatorius. Nervus obturatorius is medial, is the most medial nerve of plexus lumbalis. So it is also L2, L4, and it will run between arteria iliaca externa and musculus psoas major. And it has quite a straight course, so it should be easy for you to find it. It's a little bit hidden, but there is only one nerve that will run like this, and then you can know it's musculus obturatorius. And it will also, another identification criterion is canalis obturatorius, so it's the obturator canal, which it will run through. And it will have two branches, anterior and posterior branch. The anterior branch will run between musculus adductor brevis. Yeah, I'm sorry that I was abbreviating here. I was too lazy. So musculus adductor brevis and musculus adductor longus and musculus pectineus, typo, to supply the skin of the medial thigh as ramus cutaneus femoris medialis. Now, the anterior branch will also innervate a few muscles, so musculus pectineus, musculus gracilis, adductor longus, and adductor brevis. Magnus is innervated by the posterior branch. And take care, you already know it from this week, musculus pectineus and musculus adductor magnus receive dual innervation. Alright, that was it for the lumbar plexus. Now let's sacral plexus. Sorry, needed to hydrate. So, plexus sacralis. It is another nerve plexus that will arise from S1 to S4 nerves, but will also receive some fibers from the levels of L4 and L5. So this is commonly received via truncus lumbosacralis. So yeah. Now this one is deep, located on the posterior pelvic wall, so we can't really see it either. So I mean that's good for us, so we don't have to really study it, and we can focus on the 5 main branches. So superior gluteal nerve, inferior gluteal nerve, posterior femoral cutaneal nerve, cutaneous nerve, and pudendal nerve, and sciatic nerve. Yeah, so sciatic nerve is the largest one in the body. Alright, so comparison lumbar plexus and sacral plexus. Yeah, I think there's no interesting information in this picture other than visual comparison. So let's move on. So we have also some rami muscularis directly leaving from the plexus that will supply the muscles of the pelvico-trochanteric group. So again, you did it just this week, so it should be still fresh in your mind what muscles belong to here. So this is the group that will come or originate from the pelvis and attach to the trochanter. So that's why it's called pelvico-trochanteric group. So it will include, the gemellus muscles, obturator muscles, and so on. And it will also innervate musculus levator ani and musculus coccygeus. So these are the muscles of the pelvico-trochanteric group, piriformis, here, obturator internus. And here you can see nicely all of the branches that come off from the sacral plexus, plexus sacralis. So the first one that we will do is nervus gluteus superior. Nervus gluteus superior is this one here, and its identification criteria is that it leaves through foramen suprapiriforme. So I hope you had a good look at the suprapiriform and infrapiriform foramen during your anatomy seminar this week, because this will help you with identification of the structures. So nervus gluteus superior accompanies, of course, vasa glutea superiora, vein and artery, and it will leave the pelvis through the suprapiriform foramen. It will have 2 branches, ramus superior, ramus inferior, to supply the medial, musculus gluteus medius and minimus, and also don't forget it, please, musculus tensor fasciae latae. So musculus tensor fasciae latae is also supplied by nervus gluteus superior, by its inferior branch. Alright, next one will be nervus gluteus inferior, and it is accompanied by vasa glutea inferiora, but it will leave the pelvis through foramen infrapiriforme. So it means below the piriform muscle, so it will be this one here. So it will course laterally under the piriform muscle to supply musculus gluteus maximus. So musculus gluteus maximus, and yes. So sometimes you can see it on the interior or internal surface of musculus gluteus maximus when it's reflected. So look out for that next week. Then we have nervus cutaneus femoris posterior. So nervus femoris, nervus cutaneus femoris posterior arises from S1 to S3 and also leads through the infrapiriform foramen. And it's another giveaway criteria to identify it is the where do we have it? The nervi clunium inferiores. Yeah, because those are nerves that will curve around the inferior surface of musculus gluteus maximus, and I will try to show that to you. Give me a second. Oh, maybe I can just Google it. I was originally going to do it on the complete anatomy thing, but I think it's too laggy. So let's try to find if we can see it here. Yeah, so yeah, here you can see, I hope you can see it. So you have musculus gluteus maximus here, and then just at the inferior border of musculus gluteus maximus, we will have some nerves that will ascend back on it. Yeah, and these are the inferior cluneal nerves, and these are a branch of the posterior femoral cutaneous nerve. All right. And another branch is ramus perinealis. It will supply the superior medial skin of the thigh, as well as the labia majora, of course, and the scrotum. All right, and another important thing is that the posterior femoral cutaneous nerve runs right next to the sciatic nerve. Yeah, so nervus ischiadicus, and medially to that we have nervus cutaneus femoris posterior. All right, now nervus ischiadicus, or in English sciatic nerve, is this is now the largest nerve of the human body. It is really huge, and it is also hugely important. So this is one of the other structures that you will have to know, otherwise you will fail immediately, and it will leave through foramen infrapiriforme. Yeah, so this is this thick structure here, sciatic nerve here. It will run over the muscles of the pelvicotrochanteric group. I'm sure you've seen it, but may have not recognized it already this week in the seminars. So sciatic nerve, yeah. Now, level L4 to S3 is also important to know, and it will descend between trochanter major and tuber ischiadicum, and between musculus adductor magnus and the pelvicotrochanteric group. Yeah, so trochanter major on this side, tuber ischiadicum on this side, then pelvicotrochanteric group anteriorly, and behind it you will have the musculus adductor magnus. Now, it has two main branches, nervus, so this is another view, so sciatic nerve. It has two main branches, the the tibial and the common fibula nerve. Now, the point of division is quite variable. Usually it should be around the half of the height of the femur. But it can be higher, it can be lower. So just keep that in mind if you're trying to identify it. That can be of different height. Alright, the femoral nerve will give off some rami articulares for the knee joint and hip joint. And here I can also make a note and mention the Hilton's law. So Hilton's law states, is a rule that was established by Mr. Hilton, Dr. Hilton, I assume. And so basically Hilton's law says that any nerve that will innervate muscles acting on a certain joint will also supply this joint and the skin of this joint or above this joint with sensory innervation. Yeah, so again, if we have a muscle that will act on a joint in extension or flexion, it will also innervate or contribute to a sensory innervation of this particular joint. So because we know nervus femoralis will act on several muscles that will act on both hip and knee joint, we can easily say that it also supplies the hip and knee articular branches and for the sensation of the skin above it also. Yeah, so Hilton's law. Alright, then we have rami muscularis, which will supply semimembranosus, typo, membranosus, and musculus semitendinosus, musculus biceps femoris, and musculus adductor magnus. Yeah, so this magnus has dual innervation, the other one is the obturator nerve. And its terminal branches are the tibial nerve and the common fibular nerve. Sometimes, another typo, I'm sorry, peroneus. Yeah, so sometimes you can also find the term peroneus. It is an old or alternative name for fibula. Alright, because the tibial and fibular nerve are so important and also large, we will discuss them individually. So nervus tibialis passes through fossa popliteal, just like the common fibula as well. First, slightly lateral, and later it is actually more medial to arteria popliteal. And then it will enter the lower leg, the crus, through arcus tendineus musculus olei. Yeah, so it will be then running below musculus soleus and travel together with vasa tibialia posteriora. Now, in its terminal branches, now I will try to put back the complete anatomy thing because I think it's nicer to see some pictures as well. Let's do this. All right. So nervus tibialis will be, let's look at the posterior view, it's easier to find. Alright, so we have sciatic nerve, this big one. It will split into the tibial nerve, yeah, so this will be nervus tibialis, which will transverse the knee joint and run distally to the medial malleolus, where it will divide in its two terminal branches, which are the medial and lateral plantar nerve. Yeah, so we have I'm sorry. Yeah, so nervus plantaris medialis and lateralis. But let's do some other joints, some other branches first. So rami articularis, same rule, yeah, Hilton's law applies. So knee joint, rami muscularis for all of the muscles of the posterior compartment. So musculus surae, triceps surae, plantaris, and musculus popliteus. And another important one is this one here, nervus cutaneus surae medialis. So nervus cutaneus surae medialis is a branch that will form actually a new nerve, nervus cutaneus surae lateralis. Sorry, both of them. Wait, let me start over. So, nervus cutaneus surae medialis is a branch of nervus tibialis, and they will form nervus suralis. Yeah, so the sural nerve is formed by the medial cutaneous sural nerve from the tibial one, and by the lateral nerve. Yeah, so we have nervus cutaneus surae medialis and nervus cutaneus surae lateralis, which is from the common fibular nerve. Now, both of them will continue as nervus suralis together, and now the identification criteria for this one is also a vein, vena zaphena parva. Yeah, so usually they will run together. Again, you remember I showed you vena zaphena parva will run between the heads of musculus gastrocnemius, so caput mediale laterale, and this is also what we would expect nervus suralis, which again is formed by nervus cutaneus surae medialis and cutaneus surae lateralis. Its terminal branch will be the lateral dorsal cutaneous nerve, yeah, nervus cutaneus dorsalis lateralis. Yeah, so this is not so important for you, I guess, just for your information. So on the very right one, this leg here, this is the most common one. Yeah, so we have so nervus cutaneus surae medialis and lateralis. They will form the sural nerve, which will continue on the side, and in the midline, yeah, between the gastrocnemius muscles, and will form nervus cutaneus dorsalis lateralis. Yeah, and here are some variation. Yeah, so again the wait, give me a sec. So the most common one is here that they form like a Y shape. So like this. Oh no, Siri, leave me alone.
1 minute.
No, I don't want it. Yeah, so just like
Okay, I found this on the...
I'm sorry. So like this is Y-shaped. Yeah, so this is very typical, and this should be your identification criteria how you can identify it. Yeah. All right. So then terminal branches are the medial plantar and lateral plantar nerve. So nervus plantaris medialis will give us some muscular branches to innervate the muscles. You can see them here. And its terminal branches will be nervi digitalis plantaris communes. So the common plantar digital nerves, which will then bifurcate each of them into the proper plantar digital nerves. So nervi digitalis plantaris properly. Now the lateral plantar nerve, nervus plantaris lateralis, will supply musculus quadratus space, and ramus profundus will supply the most of the deep muscles, yeah, so including musculus interossae and musculi lumbricales, tertius, and quartus, yeah, so the lateral two ones. While the medial two lumbricals are supplied by the medial plantar nerve, yeah, so keep in mind that is also different. So medial one will supply 1 and 2, and 3 and 4 are supplied by nervus plantaris lateralis. Alright, that was it for the tibial nerve. Now, fibula, common fibula, yeah? So please, you have to specify nervus fibularis communis. If you just say nervus fibularis, it can be communis, it can be superficialis, it can be profundus, so be as specific as possible. Alright, so nervus fibularis communis will descend medial to musculus biceps femoris towards capofibula. Yeah, so capofibula towards capofibula should also be, and I don't know, maybe I forgot, I think, to mark this in red. So this is important, and it will give off nervus cutaneus surae lateralis. Again, we just discussed it. This is the one that will receive nervus cutaneus surae medialis from the tibial nerve to form the sural nerve. But the common fibula nerve will pass obliquely between musculus soleus and musculus fibularis longus anteriorly, and I want to show it to you because it's nicely visible. So here. So this will be, so what is marked right now is the tibial nerve, and what I'm trying to show you now will be the common fibular nerve. One second, anytime now. Alright. Yeah, so you can see it crosses obliquely the fibula to the ventral side. Yeah, it will run towards caput fibula. I mean, it will run together with biceps femoris, and you know the insertion of biceps femoris is caput fibula. So this is the oblique crossing to the front, and then it will split into the deep and the superficial fibular nerve. So we have nervus fibularis profundus, which will be this one. Yeah, it will run deep together. It will actually run with arteria tibialis anterior. Yeah, so if you remember, arteria tibialis anterior was just running in front of arteria, membrana interossea cruris. So it will run together with that. And the superficial fibular artery, it is this one, will give off some muscular branches for the muscles in this compartment and supply it. And in its distal portions, its distal portions. Oh, come on. All right. So again, sorry, let's go back to the common fibula nerve. So again, Hilton's law, you already know it now, yeah, so articular branches. Then nervus cutaneus lateralis is a branch for nervus duralis, we discussed it. Now, nervus fibularis superficialis, again, some muscular branches. And then these two are important, yeah, so nervus cutaneus dorsalis intermedius and nervus cutaneus dorsalis medialis. So, I'll try to show it to you. Alright, like this. So we have the superficial fibular nerve, the pink one here, and I think I'm just gonna draw on it because it takes way too long until it's like selected. So superficial fibula nerve, and it will divide into nervus cutaneus dorsalis medialis, yeah, because it's on the medial side, and nervus cutaneus dorsalis intermedius, and we also have a third nervus cutaneus dorsalis, yeah, dorsal cutaneous nerve. If you remember, we also had nervus cutaneus dorsalis lateralis, yeah, so we have nervus cutaneus dorsalis medialis, intermedius, and lateralis. Now, medialis and intermedius are the one that I showed you here. So these come from the superficial fibula nerve, while nervus cutaneus dorsalis lateralis will be actually this one here, and it will come from this nerve here, which is the sural nerve, nervus duralis. Okay, now back to our superficial one. Nervus cutaneus dorsalis intermedius will split again like this and supply the fourth and the third and the fourth interosseous space. Yeah, so again, this was 1, this was 2, this was 3, and this is 4. Now, this was easy, yeah, but what is a little bit more difficult is nervus cutaneus dorsalis medialis, because it will supply the second interosseous space completely, but it will actually not supply the first interosseous space. However, it will cross over to the medial side and supply the medial side of the foot. Yeah, so keep this in mind. This is important. Yeah, so the first interosseous space, or the skin of the first interosseous space, is not innervated by nervus fibularis superficialis, but by nervus fibularis profundus. Yeah, so this will be the next nerve that we'll discuss, the second branch. The second branch of the common fibula, yeah, so this is nervus fibularis profundus. It will give off some rami muscularis, yeah, rami muscularis for the muscular innervation. I think you should still be able to see this, to see the presentation and read with me, right? So some muscular branches for the muscles that are here, and ramus medialis. So this is this one, which will supply the first interosseous space. Yeah, so I hope it's clear now. And we also have some lateral branches for the joints of the lateral for the intertarsal and tarsometatarsal joints. Again, this is Hilton's law, yeah, because nervus fibularis profundus will act. Okay, so we can, never mind. Yeah, but I hope this is clear now. So the distribution and the innervation of the foot. So yeah, keep this in mind, and let's continue. All right. Then nervus pudendus. Nervus pudendus arises from S2 to S4 and leaves again through foramen infrapiriforme. Yeah, but the pudendal nerve is quite interesting because it will leave the pelvis through foramen infrapiriforme and then curve around spina ischiadica and then enter right back into the pelvis again. Yeah, so it just makes short excursion to the outwards world, and then go back in and enter fossa ischianalis. Fossa ischianalis he will also study at a later point, and then it will run through the allox canal and give off a few branches. So here I want to show you the pudendal nerve. This is not a nice picture. I don't know why I chose this. I think I also have another one. No. Wait. Yeah, this one. Yeah, so the red arrow here, pudendal nerve. So it will leave through infrapiriform foramen, curve around this what's it called? Spina ischiadica, and then enter right back in. Yeah, so you can see it goes out and in. You can't really see it on pictures. Yeah, so I advise you to check it out on the specimen in the anatomy seminar next week and try to find the pudendal nerve. Yeah, it's a very interesting course. And this is also very important because if you want to have a pudendal nerve block for, it doesn't matter. So this is where you want to palpate for the spina ischiadica, and because you know the pudendal nerve runs right above it or actually around it, you can like administer the anesthetics there, like you will palpate for it, for this ischiadic spine, and then administer the anesthetic, and then you will receive a pudendal nerve block. Alright, so pudendal nerve course and its branches. So rami muscularis for musculus levator ani and musculus ischiococcygos, okay. Then it will also supply or innervate musculus sphincter ani externus, and leave some nervi perinalis and rami muscularis for various muscles you will study it sometime here. And also again we have some nervi scrotalis and labialis, but this time it's posteriores. Yeah, so supply the dorsal part of the scrotum and the major labia. And also important is nervus dorsalis penis, or nervus dorsalis clitoris. So this one is the nerve that will give you all the pleasure during intercourse. Yeah, so it's the somatosensation of the penis and clitoris. Comes from nervus pudendus. All right. Okay. That was 2 hours, but I'm done now. So if you have any questions, you can ask me in the chat, or if you don't feel comfortable, you can also message me on I don't know what, and I'll reply to that. So the vessel quiz questions we already had. Maybe I'll give you, I don't know, for those of you who want to do some practice questions, I'll give you again like 2 minutes, or actually, yeah, I'll give you 2 minutes to go through these, and then we can discuss the answers, and then I also have and then we also have questions for the nerves. And like, if you feel free to leave now if you don't want to do it, but I consider like these questions here really important. Like I ask for stuff that I know is frequently examined, or that I know many people like mess up with. So yeah. Otherwise, thank you for listening, and I wish you best of luck, and also much endurance and patience during your studies of anatomy. We've all been there, and it all seems like impossible, and yet most of the people come through it. So don't give up if you have a bad day or a bad week. Keep going, repeat a lot. Use an atlas would be my tip, because visualizing the structures will immensely help you in the final examination. And yeah, please leave some feedback below. It's in the video description here, or comment box, or whatever. I don't know. I'm not a YouTuber, however you call it. Click that, and it's like only a minute or so. Give some feedback. I already know like my microphone is probably not the best, but leave some feedback there. And yeah, for those of you who want to stay for the quiz, I'll give you the time now. Alright. So let's go through the answers. So the first one, oh, I don't see. Alright, yeah, so first one. Corona mortis is an anastomosis between the pubic branches of the superior. Oh, sorry, this is a mistake. It should be inferior. Yes, you're right. Yeah, so an anastomosis between the pubic branches of the inferior epigastric and the obturator artery. What is the next question? Yeah, so the posterior compartment of the thigh is supplied via deep perforating branches from arteria femoralis profunda. Alright, it was already late last night when I did this. Forgive me. So, arteria femoralis profunda, perforating branches. And the supply of the cruciate ligaments and the menisci is through the middle the middle plantar artery. Yeah, so arteria plantaris, arteria genus media, and number 4, arcus plantaris profundus is formed by which artery? It is arteria plantaris lateralis. Yeah, arteria plantaris lateralis. And number 5, vena zaphena magna drains into vena femoralis through hiatus zaphenus. Yeah, so remember it was like the opening in fascia lata. Number 6, vena tibialis posterior are formed by vena plantaris medialis and lateralis. So again, it's just like with the arteries. Yeah, so we have arteria tibialis posterior. It will divide into its terminal branches, which are arteria plantaris medialis and arteria plantaris lateralis. So for the veins, it's the same thing. Where does the fibula veins drain to? They will drain also into the posterior tibial arteries. Veins, which will continue as the popliteal vein. And number 8, where can we find the Clockett's or Rosenmüller lymph nodes? I think, yeah. So it is in the angle between vena femoralis and ligamento inguinale. Yeah, so it is part of the deep inguinal lymph nodes, nodi lymphatici inguinalis profundi. The angle I showed you, remember? So you can go back in the presentation and look at that. Important. Alright, then questions for the nerves. I'll give you again, let's do 4 minutes. Alright, that was no 4 minutes, but we've all been sitting here for 2 hours, so let's go. Otherwise, like you can still do them. You know, you can pause the video or something. Up to you. So first one, through which space does ramus femoralis, so the femoral branch of the genitofemoral nerve, leave the abdominal cavity, and what about the other branch, the genital branch? So femoral branch leads through lacuna vasorum, yeah, together with the vessels, and the genital branch will leave through the deep inguinal ring and pass through the inguinal canal, canalis inguinalis. All right, then we have the second question. So nervus cutanus femoris lateralis is a direct branch of plexus lumbalis. And you should also be aware of like the different origins, like nervus cutanus femoris lateralis, medialis, posterior, and lateralis. No, we said so lateral, posterior, anterior, and medial. Then number 3, which vein does nervus saphenus accompany in the lower leg? So it is vena saphena magna. Number 4, through which opening does the nerve innervating musculus gluteus maximus exit the pelvis? So for that we have to know first what's the innervation of musculus gluteus maximus, and it is nervus gluteus inferior, and then you can know that this will pass through the infrapiriform foramen. Second last, what is the origin or the formation of the sural nerve? So the sural nerve is formed by nervus cutaneus surae medialis, nervi tibialis, yeah, so of the tibial nerve, and nervus cutaneus surae lateralis, nervi fibularis communis, yeah, of the common fibular nerve, and both of them will be and the sural nerve will be accompanied by the lesser saphenous vein, yeah, so vena saphena parva. And final question is, I think the answer, it was asking about, let me see, innervation of fibularis brevis, yeah, so it's already a repetition from this week's